Hello guys, so recently we covered some topics from gastrointestinal system, the signs and symptoms. First one we covered is mouth symptoms, second one is anorexia and weight loss, third one is pain, and fourth one is dysphagia, and fifth one is nausea and vomiting, and sixth one is abdominal distension, seventh one is altered bowel habit, and from eighth one from bleeding we are going to start now. So in bleeding we will see three types of total bleeding types. So firstly, what you will see, hematemesis. Hematemesis. So the meaning of hematemesis is vomiting of blood. Vomiting of blood. So we need to ask our patient that the color of the vomit and at what onset the vomiting is going on. Also the history of dyspepsia, peptic ulcer or gastric intestinal bleeding, or any kind of CLD, chronic liver diseases. Also we need to ask the patient, does the patient took alcohol before taking before having any pain. So we need to ask this type of question because these are the factors which will affect our gastrointestinal system, which will lead to bleeding. Also, one more thing we need to ask our patient: does our patient is taking any NSAIDs, non-steroidal anti-inflammatory drugs? So we need to ask our patient like everything. Okay. So if the source of our bleeding is above the gastroesophageal sphincter and which will be associated with the esophageal varices, so fresh blood may appear. Okay, so in esophageal varices you will get fresh red blood. Okay, guys, so moving forward, as we move forward we will see, suppose suppose the patient is having lower esophageal mucosal tear due to trauma or forceful retching. So forceful retching, we will call that as Mallory tear. Mallory tear. So this Mallory tear will occur because while patient took a huge amount of alcohol, so the patient will start vomiting. So due to large amount of contraction in our stomach, which will lead to tear in our gastric mucosa, which will lead to bleeding. Okay. So we have completed the hematemesis, and let's go on the second part of bleeding. Second one is melena. Okay guys, so in this melena is the passage of tarry shiny black stool with a characteristic odor. Okay, and which will result from upper gastrointestinal bleeding. Okay, what happens is, this is our esophagus, this is our stomach. So what happens is, this is our duodenum part. Sometimes what happen in duodenum, some ulcers might be present, okay, which will cause heavy bleeding. So what will happen, the stomach will fill up with blood. Okay, also afterwards what will happen, our gastric mucosa will secrete HCl. Okay, due to this HCl our blood will coagulate, and after coagulation it will become black in color. Also when this blood will pass through our duodenum, so pancreatic juices will add, also some bile juices will add. Pancreatic juices, so the bile will mix with our blood, which will result in melena. Okay, so in shortly, how you will get this melanoma is first causes. So the most basic and common causes peptic ulcers. Mostly the peptic ulcer will occur in the lesser curvature of our stomach. Okay guys, so we need to see what type of symptoms this our patient is having. Okay, suppose your patient complains epigastric pain. Okay, epigastric pain. So you will define that in epigastric pain what type of what organs are present. Okay, at this part esophageal sphincter is present. Okay, also the fundus of the stomach. Also it might be a diaphragm problem, it might be a bloating, it might be a large intestinal obstruction, or else it may be palpitation due to heart coronary artery diseases. So it's better to see what type of symptoms your patient is presenting to you. Okay, this all thing you need to ask in the history of your patient. Also, what we see in melanoma is excessive alcohol ingestion may cause hematemesis from erosive gastritis. As I told you before, that in lesser curvature of your stomach, when the patient drinks a large amount of alcohol, what happens is this alcohol dissolve your mucosal layer from your stomach, and which will lead to erosive gastritis. Okay, also the malarious tear, I already explained you what is malarious tear. Also bleeding from esophageal varices. Okay, so what happened in esophageal varices is this is your esophagus. Okay, and this is your stomach. What happened is due to increase in portal hypertension, the peripheral nerves will lead to dilation. Okay, so for portal hypertension I will make some another video how does portal hypertension affect our organ system. Okay, I will write portal hypertension. Okay, there are some factors by which the portal hypertension will going to create esophageal varices in our patient. Okay, I will teach you the pathophysiology in next video. Okay, so now we'll see that in esophageal or gastric cancer, or we can say in gastric angioectasis, these are the rare causes of the upper GI bleeding. Okay, very rarely if the patient is having any gastric cancer or in tumor or gastric angioectasis, so it's a rare causes by which we can see the bleeding is going to occur. Mostly the patient comes with epigastric pain, or the patient will come after having food, the patient is relieved. Okay, there are different types of patient, different type of diseases. Okay, in peptic ulcers and duodenal ulcers there's a differences. So what happens in peptic ulcers is while patient is having his food, he is feeling pain in his epigastric region. Okay, and what happened in duodenal ulcer is while the patient is in empty patient is having empty stomach, before having food only the patient is having pain. So the pain is due to increased secretion of hydrochloric acid in our stomach, which will result in irritation of our duodenal ulcer, which will lead to bleeding and which will cause the pain. Okay, so now let's move to our third part, which is rectal bleeding. Okay, so in rectal bleeding we need to see that the blood is mixed with stool. Okay, or the stool is coated with some bleeding kind of thing, like blood has been seen in the stool of a patient. So fresh rectal blood, uh, in medical term we say hematochezia, usually indicates the disorder in the anal canal. It might be in rectum or it might be in colon. Okay, so during severe upper gastrointestinal bleeding, however, the blood may pass through the intestine. Okay, so which will cause the fresh rectal bleeding. Okay, so common causes of rectal bleeding include hemorrhoids. Okay, hemorrhoids may be present in the patient. Okay, anal fissure. Okay, also complicated diverticular diseases. Okay, in diverticulosis what happen is, in diverticulosis, this is your intestine, this is your descending colon. Okay, suppose from some areas what happen is, the muscular wall of your large intestine, okay, is weak. So due to increased pressure, okay, due to increased pressure in the intestine, what happen is, this weak part will bulge out, which will result in diverticulosis. Okay, and which will lead to bleeding. Okay, so these are the terms which bleeding, these are the symptoms by which we can see the bleeding in our patient. So now let's move with another one. Okay guys, let's go to ninth symptom, which is jaundice. Okay, so the perfect definition of jaundice as we know till now is, jaundice is a yellowish discoloration of the skin, sclera and mucous membrane, which has been caused by due to increase in bilirubin level. So increase in bilirubin level, we will say that the patient might be having hyperbilirubinemia. Okay. Also, there is no absolute level at which jaundice can be clinically detected. Okay guys, so in good light, where most clinicians will recognize jaundice when the level of bilirubin exceed more than 50 micromole per liter. If the bilirubin level is more than 50 micromole per liter, which is approximately equals to 2.92 mg per deciliter, okay, we will say the patient is having jaundice when the level of bilirubin is more than 50 micromole per liter or 2.92 mg per dl. Okay, I'm talking about total bilirubin. Okay, I'm not talking about the conjugated one, I'm not talking about unconjugated. Okay, so what we need to ask a patient? Okay, there are some questions you need to ask to a patient, okay, while examine. Okay, so some questions are, is there any associated pain? Okay, like associated symptoms like abdominal pain, if patient is having abdominal pain or not, if patient is having chills, thrills or fever. Okay, we need to ask the patient, like everything we need to ask. Or the patient is having any weight loss from the last couple of months. Also we need to ask a patient, is there any itching or peripheral itching, because itching will occur in the obstructive jaundice, which I'm going to let you know soon. So also we need to ask a patient that color of your stool. So what was the color of your stool? It was normal, pale, and the urine color. Okay, so we need to ask a patient, does your urine was yellow, dark yellow, okay, it was white, or any secretions are coming out, any white frothing is coming out, any stones, okay, burning micturition. We need to ask each and everything. Okay, also I need to ask is the alcohol intake of your patient. Does your patient took any alcohol? Here in Nepal, usually local alcohol intake is more, so mostly the patient takes this type of alcohol, okay, homemade alcohol, which will result in cirrhosis of the liver, okay, which might be the causes of jaundice. Also we need to use the clicked, or we need to ask if the patient is taking any kind of intravenous drugs. Okay, so we need to ask the patient about his sexual history. Does the patient is having multiple sexual partners or not? Also, in past, does he had any intercourse without any contraceptives? We need to ask our patient. Okay. Also, we need to ask the previous blood transfusions, because it might lead to infection. Okay, hepatitis, HIV and all. Okay, SCV, human cytomegalovirus. Okay, so we need to ask previous blood transfusions. Does the patient is taking any blood transfusion before? Okay, and also we need to ask some patient that are they taking any kind of drug which has been prescribed from so long. Okay, so let's go on, let's elaborate this topic. Okay, so there are two types of bilirubin. Okay, in total bilirubin you will get unconjugated bilirubin plus conjugated bilirubin. Okay guys, so unconjugated bilirubin is insoluble. Okay, this is insoluble. Okay, this is not going to dissolve in the water. Okay, and which will lead to binding to plasma albumin. Okay, what happens here is when the unconjugated bilirubin binds with plasma albumin, so it will increase the oncotic pressure of your blood. Okay, which will lead to increase in bilirubin in your blood. Okay, and the conjugated bilirubin is water soluble. Okay, due to this, after conjugation from liver, by bypassing from liver, the unconjugated bilirubin will pass from liver. By the help of glucuronic acid, it will convert into conjugated bilirubin. Okay, and now this conjugated bilirubin is water soluble. Okay, after coming to intestine, it gets reabsorbed from our intestine, from a large bowel, and it will result in excretion from our kidney. Okay, which will result in yellowish urine. Okay guys, also I already told you before, conjugated bilirubin is water soluble. Okay, so in conjugated hyperbilirubinemia, the urine is usually dark brown due to presence of bilirubin dichloride. Okay, also in the colon, conjugated bilirubin is metabolized by bacteria to sternocobilinogen and sternocobilin, which contribute to the brown color of the patient's stool. Okay, so stercobilinogen is absorbed from the bowel and excreted in the urine as uricobilinogen. Okay, the uricobilinogen is a colorless water soluble compound. Okay guys, so there are three types of hepatitis which we are going to see. Okay, the first one is prehepatic jaundice. Prehepatic jaundice. So in hemolytic disorders, what we will see, the anemic pallor combined with jaundice may produce a pale lemon complexion of your patient. Okay, the stool and urine may be normal in color, but not usually. Also, what we see is there's one syndrome, the name is Gilbert syndrome, which is common, and which will causes unconjugated hyperbilirubinemia, which will increase the level of unconjugated bilirubin. Okay. Also, one more thing is here, at serum liver enzymes concentrations are normal and jaundice is mild. So mild means the plasma bilirubin is less than 100 micromole per liter. Okay, but it will increase due to prolonged fasting or intercurrent febrile illnesses of your patient. Okay, so what do you mean by hemodynamic disorders? Okay, as I told you before, in prehepatic jaundice, hemolytic okay, so hemolytic disorders means, so in our body there is one organ named as spleen, which is also known as graveyard of our cells. Graveyard of our cells. What happens is, in hemolytic disorder, the spleen will overwork. Okay, overwork. So which will lead to a splenomegaly. Okay, guys. So splenomegaly will occur. So what will happen in splenomegaly? So in splenomegaly, the spleen is already working very hard. Okay. Also, so what will happen? The RBC, platelets, and WBC, leukocytes, uh, destroying rate is faster. Okay, which will lead to anemia, which will lead to anemia. Okay, so due to this, what happened is, the patient's CBC report is totally going to a very decreased level. Okay, the patient CBC reports is going to be in very less levels. Okay, so this happens, okay, in prehepatic jaundice. And second one is hepatic jaundice. Hepatic jaundice. Okay, so in hepatic jaundice, what happened is, the hepatocellular diseases causes, according to this jaundice thing, hepatocellular diseases causes hyperbilirubinemia. Okay, that is both unconjugated and conjugated. Okay, so what happened is, in hepatic jaundice, there is an increased level of unconjugated bilirubin, also the conjugated bilirubin. Conjugate bilirubin leads to dark brown color. Okay, dark brown color. Conjugate bilirubin leads to dark brown urine. Okay, which will lead to dark brown urine. Okay, but in this disease, the patient's stools are normal in color. Okay, normal in color. And third part is there in jaundice is post-hepatic jaundice. Post-hepatic jaundice. Okay, so in biliary obstruction, conjugated bilirubin is the bile. Okay, it does not reach the intestine. Okay, so what happen is, this is your liver. Okay, this is a bile duct. Okay, from both the lobes, that bile duct is coming. Okay, due to some obstruction, okay, here is a gallbladder. Okay, due to some obstruction, what happened is, this conjugated bilirubin is going to stop. Okay, so in the intestine, Okay, in duodenum especially, this bilirubin is not going to eject. Okay, so it will cause an obstructive jaundice. Okay, so obstructive jaundice may be accompanied by pruritus. Okay, suppose the patient is having obstruction in the bile duct. Okay, and the patient will have investigation, and we finds out the patient is having obstructive jaundice. Okay, so what type of complaint your patient is going to show you? So the first one is pruritus. So pruritus means it's generalized itching. So what happens is your patient's peripheral limbs, okay, distal part of your limbs is going to itch. Okay, a severe itching will occur, which will result in bleeding. Okay, which will result in ulceration. Okay, so because the patient cannot control their feels. Okay, also the obstructive jaundice with abdominal pain is usually due to gallstone. Okay, it might happen that in gallstone there are some stones might be present, which will take part in obstruction. Okay, in common bile duct. Okay, due to which the conjugated bilirubin will not come out. Okay, in painless obstructive jaundice, it may suggest that the malignant biliary obstruction might be present. Okay, suppose a patient is having obstruction. Okay, and the patient don't have any pain. Okay, painless thing is there. It might happen that due to the pancreas upper head is there. Due to pancreatitis, the enlargement of the pancreas, this duct might be compressing. Okay, due to pancreas. Okay, or or we can say because of diverticulitis, the large intestine, okay, the large bowel sigmoid colon, it might be inflamed. Due to this inflammation of sigmoid colon, what happen is the bile duct might get compressed, and which will result in obstruction. Okay, there are many risk factors due to which obstruction may occur. Okay, it usually occurs in old patient. Okay, because in old patient that their metabolic rate is decreased. Okay, also they cannot resist the external pathogens, which will result in decrease in immune system. Okay, so in our sigmoid colon, in our large intestine, E. coli bacteria is present. Okay, so this E. coli bacteria will perforate the sigmoid colon wall. Okay, the intestinal wall, large bowel wall, and which will result in inflammation of your large intestine, which we say as diverticulitis. Okay, just a very easy term according to me. Okay, so also what happened is in obstructive jaundice, it might be due to intrahepatic or as well as extrahepatic cholestasis, as in primary biliary cirrhosis. Certain hepatotoxic drug reaction, okay, might be present. Also profound hepatic injury might be present. Okay, suppose a patient is a fighter. Okay, he's a boxer. So what happened is, due to his fight, a patient gets hit on his liver. Okay, due to that trauma, what happened is inflammation might occur due to internal side of your patient's liver, which will lead to obstruction of common bile duct, which will lead to obstructive jaundice. Okay, which we are going to say that the patient might be having obstructive jaundice due to trauma. Okay, hepatocellular injury, like cells has been damaged in patient liver, which are going to regenerate after some time, but currently the situation is the patient is having obstruction in the liver, which might result in severe jaundice. Okay, and the stool color will be normal and the urine will be dark brown color. Okay, now this everything was for jaundice. Okay, so let's go to our last symptom. Let's go to our last symptom. Okay, so our last symptom is, I think this one was the ninth one, so 10th one is totally something different. Okay, it's groin pain and lumps. Okay, so what we are going to see in a patient is there any groin swelling might be present, or the patient is having any lumps. Okay, so we need to ask about the associated pain. Okay, we need to precipitate, or we need to find the exacerbating factors such as straining due to chronic constipation, or it might be chronic cough. Okay, or it might be heavy manual labor. Okay, and what are the relationships, like how the patient can relate? Okay, with micturition. Okay, with micturiation the patient is having pain or not, without micturition pain is there or not, with micturiration pain has been disappeared. Okay, so we need to ask our patient, like what type of things the patient has been feeling. Okay, so also we need to ask one more important thing, the timing. Okay, at what time the patient feels worsen. Okay, the symptom gets worse due to what factors. Okay, it might happen that in morning time the pain is less, and within afternoon it will gradually increase. Okay, and evening the patient is intolerable and the patient will come in emergency. Okay, so what happen in groins is hernias are common cause of groin lumps. Okay, first point is hernia. So hernias are the common cause of groin lumps and frequently present with dull dragging discomfort. Okay, suppose we need to examine the patient with hernia. We will say our patient to cough. Okay, intentionally we will say our patient to cough. So what we will see is in umbilical region, the rectus abdominalis muscles present. Due to weakening of that muscle, what happen is the umbilicus area, the small bowel will come out. Okay, this happens in a hernia. Also, it might happen in inguinal canal. So in inguinal canal, your small bowel is going to come out while coughing, and while the patient is normal, your intestine will go down. Also, one more type of hernia might be present, like um, umbilicus. Okay, from umbilicus what happen is, from this is the patient's stomach, this is the umbilicus part. Okay guys, this is the patient. Okay, this is a supine position of your patient. Okay, what happen is the patient is having large curves of this is small intestine. What happen is a one curve will come out from the umbilicus area. Okay, from the main umbilicus point, that small intestine will come out. Okay, which will result in severe pain and which might result in inflammation of the umbilicus. Okay, due to this inflammation the obstruction will increase. Okay, which will result in stenosis of this area, and the intestine will be present over here. So the patient will come in emergency and the emergency department. Okay, so the patient will get repaired by the surgical method. Okay, in surgery you will study how the hernias got repaired. Okay, so for today these were the total symptoms after bleeding. Okay guys, so let's get a quick review. In bleeding you will get hematemesis. Okay, hematemesis is the vomiting of blood. Okay, we need to ask a patient if the patient is having taking any kind of NSAIDs. Okay, the bleeding might be present due to esophageal varices, which is fresh red blood. Okay, also suppose the patient is alcoholic, severe chronic alcoholic. So due to this alcoholism, the patient will vomit again and again, which will lead to malorivisture, which will result in heavy amount of blood loss from your stomach. Second symptom is melena. Okay, the second part is melena. Melena is a black tarry stool present in your fecus, from in your stool or fecus, whatever we say. Okay, this melena will convert due to hydrochloric acid in our stomach. Also the pancreatic juice will act on that blood, also bile juices, so which will result in totally black discoloration, like totally digested blood is present. Okay, and third one is rectal bleeding. So rectal bleeding might occur due to hemorrhoids. Okay, hemorrhoid in the anal canal. This is your anal canal. Okay, hemorrhoids might be present. Okay, or the fistula inside the rectum wall, which will result in bleeding from rectum. Okay, the fresh red blood you will observe in the stool of the patient. Also, because of diverticulosis is the bulging kind of disease. Okay, which will happen due to loose muscular wall, which will result in bulging. Okay, these diseases does not happen suddenly. It takes time because of the patient reliefness. The patient does not comes to hospital uh, until it worsens. Okay, so ninth symptom which we have is jaundice. Okay, jaundice is a yellowish discoloration of skin, sclera, mucous membrane. Okay, due to increased level of bilirubin. Okay, so increased level of bilirubin, we will say, as the patient is having more than 50 micromole per liter, or we can say the patient is having 2.92 mg milligrams per deciliter. Okay, so total bilirubin is equal to unconjugated bilirubin plus conjugated bilirubin. Okay, this is the basic things. Okay, so unconjugated bilirubin is the insoluble part. Okay, which will bind to plasma albumin, which will binds and which will circulate in your blood, which will lead to increase in bilirubin in your blood. Okay, by which you will see icterus. Okay, icterus is another word which we will define as jaundice. Also, the patient might be having yellowish color sclera. Nails might be yellow in color. Mucous membrane from the lips. We need to say a patient open your mouth, and we need to see from your torchlight, guide light. Okay, so we will see that. Also, the conjugate bilirubin is a water soluble. Okay, so what happened is water soluble. This will come into your blood. Okay, this will come into your intestine by the common bile duct. Okay, because no obstruction is present here. Okay, so while after coming to your intestine, it will emulsify the fat, and it will reabsorb from your intestine. So okay, after reabsorption of intestine, the blood will go to kidney. Okay, so this is a water soluble, and due to this water soluble property, the conjugated bilirubin will come out through your urine, which will be yellowish color, yellowish urine, dark yellowish urine. Okay, so the jaundice are classified into three parts: pre-hepatic jaundice, hemolytic jaundice. Okay, pre-hepatic jaundice, hepatic jaundice, post-hepatic jaundice. I recently explained you. Okay, it is not a need to explain to me again. You can easily go back to the video. Also, the 10th symptom is groin pain and lumps. Okay, the groin pains might be associated with hernia. Okay, due to hernia, patient might be having pain, or else it might be due to tumor. Okay, so it might be due to femoral aneurysm, it might be due to renal artery stenosis. Okay, so because of stenosis, what happened is, this is a renal artery. Okay, suddenly, due to some exacerbating or external factor, stenosis will occur. Okay, this stenosis will lead to aneurysm. Okay, which will uh, cause pain, abdominal discomfort. Okay, so these are the things. So for today, this is last symptoms. Okay, so in next video we will see the pathophysiology of portal hypertension. Okay guys, take care.